Awesome. Okay. Welcome, everyone. Thank you so much for joining us today. We are Pre-Health Shadowing, an international nonprofit organization. Our mission is to empower aspiring healthcare professionals by providing virtual shadowing opportunities. And thank you so much for joining us today, and we're thrilled to have you here as part of our community. Your participation and support are crucial, and you are driving us forward in shared goals in the medical field. So, um, as part of our commitment to inclusivity, we provide closed captions to support students of all needs and abilities. And we value your feedback and are always looking forward to improving accessibility. If you have any ideas or suggestions, please feel free to email us at info@prehealthshadowing.com. We're also on Instagram at Pre-Health Shadowing, and if you're on TikTok, we're there too with the same handle. And don't forget to sign up for our email list because it's the best way to ensure that you're always informed about our latest sessions and opportunities. Once again, we are thrilled to welcome students from all around the globe, and it's always fascinating to learn more where everyone's joining from. So, me, the lead of live sessions, Manasvi Sharma, I'm joining from San Jose, and feel free to share in the chat where you guys are calling from. I don't see any responses yet. Ooh, Los Angeles. Anyone else? Okay, feel free to jump in the chat as we go. Orange County. North Carolina, Florida, Chicago, Dallas, New Jersey, ooh, Texas, Colorado, NC, North Carolina. Yes, this is a very diverse group. I'm so glad to have you guys here. Okay, let's continue. So, if you guys are interested in being part of pre-health shadowing, we have a fantastic opportunity for you to join us as a volunteer. And it's completely remote, so you can contribute from anywhere around the world. And to get started, just register to our website, and you can gain valuable experience and make a positive impact. And if you have any questions, feel free to ask me by staying back at the call, or you can also visit our website for more information. Along with that, we're also recruiting for our leadership team, and it's open to everyone. So if you want to apply your skills, learn new ones, and make a new impact, then you could all do this with the comfort of your home, and it's 100% remote. You can just head to our website and fill out the application form. Some of the roles we have here are listed here, and we're looking for leaders in all these departments, but it's not limited here because you could also propose your own new department or role. If you feel free, it can like holistically help PHS. So if any of these roles resonate with you, I encourage you to use the link provided to join our team. Along with this, if you are a high schooler, our high school training program, or HTP, is a fantastic way to gain valuable skills and insights in both leadership and the healthcare field before you step a foot into the college campus. All you need to do for this is fill out the interest form, and that's available on our website. Apart from this, our entire operation relies on generous donations from all of you guys by our dedicated volunteers. And this is what allows us to continue offering these opportunities to learners like you from all backgrounds and all around the world. So if you have the means, just please consider making a donation. Even $1, every contribution, no matter the size, helps us maintain and grow this inclusive educational experience. If you have any questions, feel free to answer them in the chat. And we want this to be an interactive and informative session, so please don't hesitate to participate. And we will go over them with our Q&A leads at the end. After completing this session, you will have the opportunity to earn a digital certificate. This certificate verifies your hours and can be accessed at the professional course page at Pre-Health Shadowing. It's good if you guys take notes because these notes will be valuable for during your assessment if you want to gain hours. Along with this, it's also recommended because it can enhance your learning. Remember, the certificate is a great addition to your portfolio because it helps showcase your dedication and the skills you've acquired. Lastly, if you guys could turn on your camera, that would be really great because it helps us replicate an in-person environment, enhancing the experience. Now, I'm pleased to hand things over to Dr. Britton. We'd love for you to share a bit about yourself and take it from here.
Yes, so good afternoon or good evening to everyone. My name is Dr. Aariyana Britton. I am from the Virginia area. So I see a lot of familiar names in the chat, and that makes me so happy. Thankful to my Virginia family for joining in. And I see a lot of new names and a new environment that I'm getting used to. So that's also great. It's nice to see that we have people from all over the US. So I'm just amazed and thankful that you all are here to listen to what I have to say and to learn a little bit more about public health. I received my Bachelor's of Science and my Master's of Science in the public health sector, as well as just completed my PhD in public health as well. And so, thank you. So, I'm very excited to share not only my presentation about what I do, but the other different ways that you all can get involved as well in public health. So, I'm going to go ahead and share my screen. All right. Is everyone able to see it?
Yep, looks great.
Okay, awesome. Go ahead and present. And so, like I was saying before, my name is Dr. Aariyana, and I am presenting today on the public health sector, specifically what I do in public health surrounding community health and engagement. This presentation is about building equity through voice, vision, and visibility, as well as some leadership, advocacy, and the power of representation in healthcare. This is something that I'm extremely passionate about because I do community health and wellness as well as disease prevention. And a lot of the times I'm working in rural communities. And so that advocacy and the leadership is very important, not only for me, but for others in the communities that I serve. And so I wanted to bring you a presentation that not only tells you about the public health field and what it is, but how important it is to the field of medicine and health sciences. So our objectives for this presentation includes what is public health. So I'll be giving you a little bit of a background on public health, why leadership matters in public health, the core traits of public health leaders. So if you are thinking about going into the public health field, I have some core traits for you. Advocacy, which is the heart of public health and health equity. Advocacy and action. So what does advocacy look like day to day as a public health leader? Representation, the cost of underrepresentation. So, what happens when our communities continue to be underrepresented? Health equity stats, the intersections between leadership, advocacy, and representation. Building your public health legacy. The Cornerstone Project, which is a story that I came up with and that is based on a true story. Who tells the story? And then a call to action for all members of the public health world and sector. And then at the end, we'll have a little bit of a discussion too. So, what is public health? I would be beside myself if I didn't tell you what public health was as a whole before we got into the nitty gritty of what we can do as professionals. So, public health protects and improves the community's overall well being. Public health is about improving systems so that every community can thrive, regardless of race, gender, ethnicity, or morality. It focuses on prevention and not just treatment. And it works through education, policy, research, and community partnerships. The entire goal of public health is to ensure equity and access for every population. So, public health is the big umbrella to a lot of the medical concerns that we currently have in the United States. Public health professionals are the ones that are behind the scenes keeping up with all of the treatments, all of the policies and education, all the community partnerships. Public health is the backbone of healthcare in general, and it makes sure that access to healthcare is possible for everyone. So that's a little bit about what public health is and why it's so important for communities to not only have a public health system, but to acknowledge the fact that public health is very important in the medical field. So, why does leadership matter in public health, you may ask? Why is it important to be a leader in public health or to have a career in public health? For me, I noticed that leaders drive population level changes. I work in community health, as I stated in the beginning, and me being in the communities that need me the most, such as rural communities or communities that may not have a public health system, I've seen drastic changes. Leadership equals vision and collaboration. So, an idea can spark so many other ideas and collaborations in the field of public health. Because we don't focus on just one thing in public health, it's so easy to target every disease and every disorder and every type of help that someone may need. And it's not just medical related, it can be food related, it can be any type of public health concern that you think of. Every role, from interns to policymakers to community health workers to nurses to doctors, all of us shape community health. Public health in general includes all of us, and leadership extends beyond the clinics. So, public health extends beyond just being in a medical setting. It's in neighborhoods, it's in schools, it's in policies, it's in the White House currently. Public health is everywhere. And public health leadership begins where compassion meets strategy, where it also meets the work being done as well. That's where public health and leadership coexist. And that's why it's so pertinent that community health and public health includes everyone and not just a certain type of medical professional, because we all are important in this public health fight. So, some core traits of transformative public health leaders. So, what does a public health leader look like, you may ask? Well, oh, let's go back here. I think I skipped one. Nope, I did. Okay. Okay, so core traits of transformative public health leaders: cultural humility and empathy. A lot of individuals who are in the public health field, we're very humble. We're very empathetic towards others. We love people. We love being in the midst of community. That's something that to be proud of in the public health field. Public health looks at the bigger picture, like I said, and not just individual illnesses, but the people who are there helping, whether the individuals are sick or healthy. Those are the people that are behind public health, and that's a great trait to have. Other core traits of a public health leader: you think of systems, you think of life going in paths. You make an idea and you come up with ways to make that idea come to life. You collaborate well with others, you hold others and yourself accountable. You make a lot of evidence based decisions. I do that a lot. And you have the courage to confront inequalities. Public health as a whole is about not only helping those who need it, but helping those who don't have the access to the care that they need. So, which of these skills are you developing currently? If you are an undergrad, or if you have a master's degree, or if you're in the workforce now, which of these skills are you currently developing before becoming a public health professional? Just drop it in the chat. I love to see them later. These are some traits that are very important, um, especially if you're going into the public health field, because there are a lot of systems that you have to tackle. And again, these systems include housing, they include education, food access, environment, healthcare as a whole. All of those are great. But the main core traits that you need to have as a public health professional is to be someone who can connect with others. You have to be able to go into a community and help and not judge them based off of what they have or what they don't have. You have to be someone who understands that public health looks different from everyone. Healthcare looks different for everyone. And to be able to share with them the resources that they need in the way that they need it is very powerful. So, public health leaders have to be strong. They have to know how to connect with those who are getting health care. So let's talk about advocacy. We've talked about that a little bit, but let's talk more about it. So, in my role as a community health worker and health specialist, I do a lot of advocating for my clients. I do a lot of advocating for the people that need it, specifically in the rural areas where I'm servicing, because the nearest hospital to us is about 40 minutes down the road. So, I find myself advocating a lot for people who just need help and need the resources that they don't have access to. And so, in public health, which is the heart of health equity, we have to use our voice to change conditions that create diseases. We have to use our voice to operate on personal, community, and policy levels. We have to be everywhere. We're not just in the clinics, we're not just in the hospitals, we're in the community. We're at the homes of the individuals who need us. We're at Congress, we're at the House of Representatives. We're talking about policies and things that'll help our communities. We also achieve structural changes. So advocacy allows you to achieve those structural changes that you need, and it turns research into action. So health equity happens when we fix the conditions and not just treat the system or the symptoms. Health equity in general and public health happens when we're all together and we're all looking at the deeper meaning behind things and not just the symptoms and not just the disease or the disorders that are happening. We look deeper into that. A hospital treats one patient, I like to say, but public health prevents hundreds from getting sick, and public health also provides hundreds with the resources that they need. Every successful public health effort, whether it's seatbelts or clean water or vaccinations, began with advocacy. They start with someone advocating for someone else and advocating for the things that they need and for others to need as well. Representation in general starts with advocacy as well. When diverse voices lead public health initiatives, solutions better reflect real communities. We're able to speak to those individuals in real time and advocate for what is needed in the public health field. And I think that is one of the most important things about being a public health professional is that you have a voice and you're able to advocate not only for your clients, but the communities as a whole and advocate for what they need most. So, some advocacy in action. I know we've seen a lot of advocacy lately as far as elections coming up. Today is election day. So, we've seen a lot of advocacy come up regarding human rights and just voting in general. But advocacy in action includes policy reform. So, sustainable changes made to laws and bills, immediate relief. We've seen partnerships create lasting actions. And an example that I gave you here about advocacy is that advocacy leading to expanded food and improved maternal and child health policies. I've actually worked with both of those. And to give you an example, leading to expanding food, I work in a rural community and we have a program that's called Food is Medicine. So this program was able to not only start to help the food insecurity in the rural area that I'm from, but it was able to teach and advocate for healthier foods in the area and teach individuals how to cook the food that they're eating, how to combat some of those diseases like heart disease and diabetes. And it also improved health overall. So we started with a goal, we started with a program, and then with that program, we saw vast changes, positive changes that were able to help the people that we were helping. So it's not just what we do, it's how we do it. Healing happens in how we lead, listen, and communicate with one another. And that's what public health is all about. It's the why, it's the how, and it's the what we do that matters to the communities that we're serving. Representation. So we talked about advocacy, and we need to talk about representation as well. So, with representation, this is a public health imperative. I said before that diverse leaderships reflect community realities, and representation improves the trust and communication and participation of those in the communities that we're serving. Inclusion fuels innovation. Representation is not tokenism. No matter what we hear in the media or what we hear in the news, representation is not tokenism. It is effectiveness. We are building culturally representative teams that design better interventions. We are adding more young people to the mix. We are adding more community voices, more Black and Brown voices. We are making diverse leadership a thing because we need to improve trust, communication, and participation in the healthcare field and the public health field. And I've seen firsthand how important it is to have someone that understands where you are coming from and who you are as a person and as someone who is in a certain religious group or someone who's in a certain race or gender. I've seen firsthand how important it is that we keep representation in the public health field because realistically, improving someone's trust in you will improve the way that they're cared for. They'll be more susceptible to understanding what you need them to do and staying with a certain treatment plan when they know they can trust you, when they know they can actively communicate with you, when they know that you're there for them and you understand exactly where they're coming from. That's important. And so that's why representation matters, not only in the public health field, but in all the fields as well. Specifically when it comes to advocacy and public health and working in those communities that we may not be familiar with, but we get familiar with them because of the job. That's why representation is important. And so when we don't have representation, there's a cost. We've seen a lot of these costs happen lately, again, in the media and just in general with Congress. We've seen underrepresentation vastly, and we've seen what happens when we don't have the representation that we need in public health and healthcare in particular. So policies miss marginalized voices. There are research gaps where they perpetuate inequality and inequity. Community mistrust deepens, and it happens. It is a real thing. Community health and population health as a whole deteriorates. There is a lot of mistrust in the healthcare system right now as a whole, but that mistrust continues when we don't have the correct representation that we need in the field. And so the overall consequences of not having representation in public health and healthcare include higher chronic disease burdens, mortality gaps, poor health outcomes, and just bad medical care in general. For us as public health professionals, we have to be represented in a way where the community trusts us. We are able to share community health and population health. We're able to give these resources and get individuals to the healthcare system. And we can't do that if we're not being represented appropriately. And so let's add in some data. I love data. And data says that Black and Hispanic professionals are actually underrepresented in both research and leadership roles. So if we're both underrepresented as a professional in leadership and research and healthcare and medical roles, that's only going to add in the mistrust for the healthcare field. That's only going to increase the community health deterioration and increase the chronic disease burdens. That's why I actually got into chronic disease prevention because I saw an issue and I saw a public health problem and I found my niche and I was able to find something that I truly enjoy preventing. And working in rural areas and working in community health has been so rewarding for me because I'm able to see those poor health outcomes go into good health outcomes. I'm able to see those chronic disease burdens, specifically the ones that are preventable, just go away and individuals living happier and healthier lives. That's something that's important to me. And I've been able to see that through the representation of me being in these areas and allowing for myself and others to come in the community to make sure that they have everything that they need. So some quick equity stats here. The life expectancy gap. So there's up to a 15-year difference between the richest and poorest zip codes. That's a big one. We have a 15-year difference. I'll say it again. We have a 15-year difference of life expectancy between the richest and poorest zip codes. That includes whatever state you're in. So whether you're in Virginia or Colorado or California, there's a 15-year difference between the richest and poorest zip codes. Black women are 3 times more likely to die from pregnancy-related causes. Chronic disease is more prone in rural communities than urban and suburban areas. That's actually what my PhD dissertation was on. It was on chronic disease, specifically cardiovascular disease, and how that's more prone in rural communities than urban and suburban areas. And representation in leadership. So when we have representation in leadership, it's been shown data wise that that improves trust and outcomes. This is very important in the public health field because all of these are public health concerns. We have maternal and child health concerns, we have chronic disease concerns, and then, of course, life expectancy is the biggest concern with public health professionals. So, all of these things tie into the public health field and the equity stats that we're currently seeing. So, how do these three things overlap with one another to go under the big umbrella of public health? Well, leadership and advocacy and representation all go under healthcare and they all go under public health, specifically community and population health. Leadership directs the vision and it makes it plain. It shows who's in charge, what needs to be done in order to be in charge, and allows for leadership to take way to whatever the plan is to help communities. Advocacy is what drives the mission. It drives the community. It's what drives the leader every day. I like to say it's what helps a public health professional gets out of bed every day. It's something that we're very, very passionate about. And when we do have a passion and when we find that niche, like I was talking about, so for me, it's rural health and rural communities. For someone else, it may be cardiovascular disease, it may be pregnancy related deaths or maternal and child health, whatever it is, or women's rights, whatever it is, that advocacy is what drives our mission into being a leader in public health. And then representation. Representation is what sustains the movement. And representation isn't just about having different races or genders. It's about inviting people to the table who wouldn't normally have a seat at the table. So, community members, those grocery store workers, very helpful. Those individuals who drive the bus every day for children, school leaders, coalition members, having different people at the table is what's very important. And so representation sustains the movement. It allows for everyone to have a seat at the table and for everyone to have a shared goal and a shared idea of what public health is and how to solve some of these public health crises that we're seeing. And so, an example that I have here is community based participatory research led by diverse teams. So, inviting stakeholders to the group that would normally not have representation, accepting internships and jobs in rural communities. So, serving a community that wouldn't normally have these type of people in their area or wouldn't normally have the healthcare that is considered good or well, and then providing care to underrepresented populations that is both evidence based and patient centered. And when I say evidence based, I mean where data backs it. And then patient centered, focusing on the patient themselves and not just their disease or their disorder. Public health focuses on the person and it focuses on the disease, yes, but it focuses more on the person and how we can help the specific person overcome what they're dealing with. Equity emerges when these three forces overlap with one another. Equity is able to come to the forefront when we have great leaders, great advocates, and great representation in our field. So build your public health legacy. Know your why. If I could give you one word of advice to build your public health legacy and to become a public health professional, it would be the word why. Why are you doing this? Why do you want to be a healthcare professional? Why do you want to work in public health in general? Um, it's very easy, especially nowadays, to get tired of being in the public health field. There's so much uncertainty. We're currently going through a government shutdown where a lot of public health workers have either been furloughed or laid off. And so, if you don't know your why, a lot of these things will get to you and will deter you in the wrong way to not even want to be in the public health field in general. So, the number one thing that I will tell you is to know your why. Know why you want to go into public health, know why you're interested in this fight, know why you want to fight in the first place. And then once you figure that out, use your platform to elevate others. Make sure that the platform that you decide to use, whether you're in a boardroom, whether you're a healthcare professional or a healthcare teacher, Or you're someone on Instagram that simply likes posting about great drinks that help you sleep at night or new energy products that just happened and launched. Whatever your platform is, make sure that you're utilizing your platform in a great way and that you're elevating others with your platform. You don't just have to have a big job to talk about public health. You can be an intern, you can be a policymaker, whoever. You can be in the field of public health without having a major title. We are all public health. Lead with authenticity and evidence. So lead with being true to yourself, true to what you know, true to your why, and true to whatever it is that you want to see changed in the public health field. And number four, find your niche. I was able to find my niche because of something that I grew up with. I grew up in a rural area, and that's something that I'm very passionate about. And I love talking about rurality and ways that we can make rural areas better healthcare wise. That's my niche. So find your niche. Find something that you're very passionate about. Again, whether that's maternal and child health or whether that's cardiovascular disease, diabetes, whatever it is, find your niche. Find something that you're passionate about and go for it. Go after it. We need so many public health professionals and community based professionals. We would love to have you here. So find your niche, whatever it is. Find it. Find two niches. Switch up your niche, whatever it is. Public health is such a big field. You don't even have to just pick one thing. Find something that you're passionate about and go for it. What health injustice fuels your passion? That's a question that I was asked recently, and I wanted to ask you that question as well. What health injustice currently fuels your passion? If you don't have one, that's fine. You don't have to have one. But if you do have one, that may very well be your niche. So think about it. Think about what health injustice fuels the passion for you becoming a healthcare provider or a public health professional. Usually doctors and nurses and public health professionals, anyone in the healthcare field has a story or they have a reason why they're into the field in general. And so stay strong with that. Always hone into that, especially in the public health field and the healthcare field, because it won't be easy. But knowing who you are and knowing why you started in the first place is very important. And so I want to share a small story with you. Again, this was based off a true story, and it's to showcase that your advocacy as a public health professional makes big impacts, whether you think it did or not, or whether it's something small or something major. Anything that you're doing that involves advocacy and being there for someone and doing community health, it makes a big impact. So, a group of public health graduate students in Baltimore noticed that many neighborhood corner stores lacked affordable, healthy food options. So, this was something similar to me in my rural area and why we created one of our food programs. And so, residents, especially children, relied on chips, sodas, and processed snacks for most meals. Instead of writing another report, the students partnered with the local store owners and advocated for small changes. So they advocated for adding baskets of fresh fruit, bottled water instead of the sodas, and low sodium snacks near the checkout. So they replaced all those chips and candies that we normally see in front of the checkout areas. They replaced that with fresh fruit, bottled water, and low sodium snacks. They even helped apply for many grants to cover refrigeration costs and used community surveys to gauge interests and barriers. So they asked the communities how they felt about them adding in healthy refrigerators, about how they felt adding in fresh fruit and bottled waters and low sodium snacks. They invited the community to give them what they wanted as well. And when we did this, within 6 months, 11 stores added at least five new healthy food options. So that one store was the pivot for 11 other stores to change what they had at their checkout counters. Sales in fresh fruit increased by 40%. Customer surveys showed that a 15% increase in healthier purchasing habits. So, by the community seeing those healthy foods and healthy items, they actually had a 15% increase in healthier purchasing habits. And the local health department used their model to expand another initiative across the city. Again, this all started in a small neighborhood in Baltimore where students, graduate students, saw a problem. Instead of just writing a report about it, and instead of just writing a school paper about it, they saw an issue. They talked to the local store owners. They advocated for healthier food, bottled water, low sodium snacks, and they even got the community involved to see the interest in some of the barriers that the individuals had. And by doing this, it led the local health department to use their model to expand the initiative across the city. That's what public health is all about. Advocacy doesn't always start big. It doesn't always start in Congress. It can start at your next board meeting. It can start on your street corner, at the Walmart down the street. It can start at the community center. It can start wherever you are. It doesn't always have to start big. One small idea can lead to a bigger idea that can lead to bigger changes. Small, evidence driven efforts can shift community norms and inspire systemic change. Public health is just that shifting community norms and inspiring systemic change. We see a problem, we come up with a solution to that problem, or we come up with ways that may help this problem. We gather the data for it and we go forth and we make actual changes. And they may be small, they may start out little, but in the end, it creates bigger changes. And that's what it's all about. That's what public health is all about. And so, who tells the story? So, I just read a story, again, that was based on a true story, but who tells the story after the fact? Is it us? Is it the public health professionals? Or is it the community that's being helped? Our actions aren't just public statements, they're public relationships. We're able to build these relationships based on the statements that we make, based on the initiatives that we start, and based on the ideas that we create. So it's not just us telling the story. It's not just your healthcare professionals telling the story and leading the show. It's the community. Again, everyone is public health. We are all public health. We all utilize the healthcare system, whether it's when we're sick or when we see our doctors once a year, whether it's getting vaccines or we work in public health. We're all public health. And our actions aren't just public statements, they're about relationships. Our actions lead to better reactions. And so, in the field of public health, one action is the catalyst for major change. That's what public health is all about. That's who is telling the story. That's what the advocacy is for. That's what the leadership is for. And that's what the realm of healthcare is for. And so, this is my call to action to you, whether you're a public health professional or whether you're someone who's just now getting into public health or you're a student. This is my call to action to you. Join a public health association or coalition. Those are great as mentors or mentees. They're great for you to understand the current world of public health and to learn more about what's going on in the public health realm. Some of these coalitions are actually making sustainable changes. There is a coalition that I work closely with that has been able to create sustainable changes, not only in mental health, but physical and emotional health as well. And being a part of this coalition has not only made me a better professional, but has allowed me to see the public health realm from a different lens. Of course, advocate for what you want to see different in the public health realm. Advocate for those who don't have a voice. Advocate for the individuals who need those resources, who need the help to live happier and healthier lives. As a public health professional, whether we like it or not, we automatically become advocates for something. So advocate for your niche, advocate for your why, advocate for those individuals, again, who need the help, who need the support of the community health and population health professionals. And then mentor, volunteer, utilize pre health shadowing, utilize other groups as well, amplify those community voices. I'm someone who's all about mentoring and volunteering and making sure the community is heard to the best of my ability. So make sure you're there at those community events, even if it's something that's completely not related to what you're doing. Make sure you're talking to people about healthcare and about public health and about what's going on in today's society. We need more mentors. We need more volunteers. We need more people who are interested in going into the communities and spreading the public health joy around each other. Equity starts with being informed. It starts with being intentional, and it starts with leadership. And that comes from you. That comes from the public health professional. If we're able to make sure that everyone is getting the healthcare that they need and the resources that they need, we have to inform them. We have to be intentional about what we're teaching them and about the resources that we're giving them. We have to be leaders in this field, because if not, the public health field will not grow and it won't prosper. And we don't want to see that. We want to see the public health field continue to grow and continue to prosper and to help all the individuals that need help, and not just some, not just the people who can afford health care, not just the people who live within a 10-mile radius to a hospital or to an urgent care. We need to access everyone, because healthcare and public health is for everyone. So it is our job to mentor and volunteer and amplify community voices. It is our job to join those coalitions and to join those public health associations and to advocate for all those who need it the most. So let's have a discussion. I know we'll have some questions as well at the end, but I want to leave you with just a question that I always ask myself and a question that I always ask others. How can you use your training? How can you use your education and your voice to disrupt inequities in your future career? So, if there's an inequity that you're passionate about, if there's something that you want to do or you want to see changing in the healthcare field, how can you utilize what you're doing now, even if you're just a student? How can you utilize what you're doing as a student, or what you're doing as someone who's a director of health or a community health worker, a patient advocate, even if you're a nurse or a doctor? How can you use your current training to disrupt some of the inequities that we're seeing in the public health field and the healthcare field? That's the question that I will leave you with, because questions are great. We know them to be a little tedious sometimes, but when you ask yourself questions like this can continue to drive what you need to do in public health and can actually show you the realm in which you're supposed to be in. And I believe that asking yourself this question allows for you to remember why you started and who you are, and to remember the individuals that you're serving, because patient centered care happens when we're able to use our training to the best of our ability to make sure that these individuals are receiving happy and healthy care, and making sure that they're getting what they need, because we are here to help them. And so, how can you use your training to further the public health field and to disrupt some of the inequities in your future career? If you are going into healthcare or public health, how can you utilize this and this training and other trainings that you're going to be listening to? How can you utilize this to best help serve the society and the population around you? Those are some questions that you should ask yourself if you're getting into the public health realm. And so that's all that I had for you today. Again, I am Dr. Aariyana Britton, and I am a community health specialist. I focus a lot on community health, if you didn't tell, or public health in general. And I work mainly in rural communities where I service them, and I provide all the resources that they need, whether it's food, water, shelter, healthcare. I do it all in the public health field. And the best thing that I've done specifically in the field of public health is to help others. Is to advocate for them, and it's to make sure that they have what they need. Because again, all of us are public health, and we are all responsible for the healthcare system in the country in general, but in the world as well. Because the public health field is the same, regardless of where we are or who we are. We all have a mission to touch into public health a little bit, even if we're going into another field in medicine and public health. We tend to go into public health and community health a lot, because we're helping these communities. We're helping those that need it the most. And so stay connected. If you want to learn more about public and community health, or rural communities, or just providing resources in general, and advocating for communities, here's my LinkedIn, my Facebook, my Instagram, and my Gmail as well. So send me a message, and I'll be happy to share what I know and everything that I've learned so far being a public health specialist.
Thank you so much, Dr. Britton, for your presentation. And honestly, I really loved the way you ended it with the discussion because it really, I feel like it tied everything together and what you've shared about finding your why and building your legacy. And we could ask questions now. Um, I had one, and it was
Yeah.
that you mentioned that you work at the Virginia Health Department. So if you could walk us through a recent public health challenge your team had and how you guys tackled it.
Yeah, so I know for me, like I said, I work in a rural community, and so a lot of the times, resources are either scarce or we have to do some digging in order to find those resources. And we are currently going through an insurance crisis, if you will. We had a company pull out from some of our rural communities, and so we've just been really diligent in finding insurance, not only for those who are in the rural community but those who are very dependent on the Medicaid and Medicare concerns that are going on right now. And so I think the the toughest part has been just making sure that everyone has the insurance that they need and just continuing the fight to show them exactly what they qualify for and what it is that their doctors or their providers will accept. So I've seen a lot of my clients currently going through that, and it's been tough because a lot of people need insurance in order to afford healthcare. So that's a big one for a lot of people. And so I've just been really diligent on focusing on that and just advocating for better insurance needs in the area, specifically the rural areas that are currently suffering.
Yeah, that's really great.
Thank you.
Does anyone else have any questions before I ask my next one? Okay, great. Um, and I remember you also mentioned how important advocacy is in public health. So,
Yeah.
how do you balance pushing for policy changes like the insurance one while working within the government systems?
Yeah, so I've always been very passionate about being an advocate. I noticed that I really enjoy talking to people and I enjoy speaking about healthcare inequities, specifically those that not many people like to talk about, like the maternal and child health realm or just community health and rural health in general. And so I balance that. I won't say easily, but I balance that with what I know and what I work in day to day. I work in a rural community, and so it's easy for me to advocate for rural communities and for diseases that are prone to rural communities because I see it every day and I'm able to kind of pinpoint what it is that these rural communities need. I don't know if you all caught what I said in the beginning, but I grew up in a small town where the nearest hospital for me was 45 minutes down the road. And I know how I felt when I was sick and I had to wait 50 minutes to drive to the hospital and then another hour before I could be seen in the hospital. And so I like to think of how I felt during that time. And I also see how my clients feel. And I see what's going on in the current rural communities. And I like to advocate for that. I like to talk about it. I like to make sure that everything's on the table because if not, then it gets forgotten. If we don't talk about the issues or the inequities that are going on currently, we forget and we just swipe things under the rug. And so I like to tie my work into my advocacy as well. So I do both kind of at the same time.
That's really powerful. Oh, I see a hand right now. I'm sorry if I butchered up your name, Nahom.
Yep, you got it. Um, Thank you for the presentation. I just had a quick question. You mentioned
Yeah.
that public health associations or coalitions are a great place to learn about public health. Are there any
Mhm.
other resources that you think are valuable to help an individual learn more about public health?
Yes, so I am a firm advocate in reading. I love reading. So if you can get your hands on any public health related book, I think his name is John Green, if I'm not mistaken. He has a new book on tuberculosis, and it talks about tuberculosis, but it also talks about the inequities surrounding disease and disease prevention. And so that book is very powerful, and there's a lot of other books that are equally as powerful as that one to read. So reading and then staying up to date with the news, staying up to date with current politics and what's going on, not only in the media, but what's going on in general and in your state. I know my state just had a big election today. So making sure you're being diligent on focusing on what is going on currently in the government and with politics, as well as reading up on everything that you can. And then my favorite thing to do is to go to conferences. So not many people like conferences, but I enjoy going to conferences and making sure that I'm learning all that I can from other healthcare professionals and making myself known in the public health field, simply because that's the way to learn more, to talk to people and to network. So definitely read up on any type of healthcare concern that you're specializing in or whatever you want to notice. Pay attention to politics and what's going on, and go to conferences, network with other individuals, and then still join the coalitions and the public health associations for sure, because you'll learn so much from doing all of that. And that's what I do, and that's what I still do.
Thank you so much.
Mm-hmm.
I see another one. Praise, would you like to go next?
Yes, hi. Thank you so much for this presentation. I do have some questions. I was wondering, what are some research that you do about women's health, especially for like younger, but before like going to puberty, and now also about, I know there's very little research about women in menopause and stuff like that. So I was wondering, do you have any like opportunities or any research, things I can look into?
Yeah, so I know currently, as far as menopause goes, I know the American Public Health Association, they actually have a couple of coalitions that you can join that deal with maternal and child health, specifically women in the menopausal age. I know it's been in my state in general, in Virginia, we've had a big influx of maternal and child health. People just coming in and being really interested. The governor actually released a maternal and child health initiative where we focus more on moms and babies and anyone who is just interested in women's bodies as a whole. I would start there. I would start with, like I said, the American Public Health Association. And then I would also start looking into just different foundations for women's health. There's so many women's health foundations out there. We have like the Black Women's Health Imperative. We have so many just maternal and child health realm things. So I would start in the maternal and child health realm and then go from there. Also, being very diligent in finding webinars and finding groups who are leading things surrounding menopause and maternal and child health. That's been very helpful for me. And just again, focusing on what's going on currently with politics and then in the government, and making sure you're just staying focused on all of that, because we often do see a little bit of maternal and child health research. There is a huge gap with learning what's going on with menopause and healthcare with maternal and child health. But in order to overcome that gap, we have to do the research ourselves, and we have to find the people in the groups that are currently doing it and making sure we're staying connected to them. So I hope that helped.
Yeah, Dr. Britton, you're really helping us connect our personal stories to our future work. Thank you.
Yeah.
And for the next person, I see Blue Aid Innovations. Do you have a question?
Can you hear me?
Yeah.
Me and my team have been developing several different ways of fighting infection. I was wondering what is the best way to include and incorporate the values that you've been talking about in your presentation into us developing this and making it more accessible to people that are less fortunate.
Yeah, so if you're talking about disease prevention, you want to know your audience. So know who you're talking to, know who you're trying to prevent disease for, and don't be afraid to add that into the presentation. Don't be afraid to add those statistics into whatever and whoever you're talking about. I think it's very important to be I guess, upfront about what you're talking about and who is suffering mostly from these diseases and disorders. Because if we don't talk about it, again, it gets swept under the rug and it's not helpful. So make sure you're diligent in knowing the community and adding in the resources for that community and making sure you're targeting who it is that you want to present to. We like to make things generalized, and it's okay sometimes if we're talking to a generalized population. But if you do have a specific population in mind, or a specific group of people in mind, make sure you understand that they are going to want to see not only true things, but they're also going to want to see their stories highlighted. It's important to not only share your personal story, like was just what we just said. It's not only important to share their personal stories and to share what they're going through as a community, but it's also important to have um, that just that data there too. So make sure you're very diligent in adding both of those in. And in order to do that, again, you have to understand the community and not just feel like you know the community based off of what you read or what you're seeing. So be diligent in being in the community and add in those community voices, and your presentation will be spot on.
Thank you, I will.
That was such a valuable insight. And apart from this, Dr. Britton, you also seem really passionate about mentorship. So I wanted
Yeah.
to ask you, what was the biggest adjustment for you when you were transitioning from an individual contributor to leading and mentoring a team?
Yeah, so I actually started out, like a lot of you, with pre-health shadowing. I was very diligent in making sure I caught a lot of the Zooms surrounding public health and just medical care in general. I learned a lot from other people who were able to mentor me at that time. And I told myself whenever I finished school, I would come back, not only here, but just come back in general and just mentor the next generation of public health professionals, because public health, it can be a lot sometimes. And so my transition from being a student to now being the mentor and actually helping people, it was an easy adjustment because I had great mentors as well who were able to help me and guide me into the field of public health, and they were able to show me what it takes to not only be someone that public health professionals can look up to, but a great mentor as far as students and undergraduates and even students in high school. So I think it was a good adjustment for me because I best prepared myself by finding those mentors and speaking with other people and being diligent and networking any chance that I got.
Yeah, that's actually a very valuable insight. So looking back, is there anything you wish that someone had told you before making this transition?
Um, I wish someone would have told me that the work doesn't stop. The public health work doesn't stop. Even outside of what I do in community health work, I'm a caregiver for my mom. And so I'm always doing something public health related. And I always find myself being an advocate for something in the public health field because, again, healthcare just doesn't stop. There's always going to be some type of public health concern. There's always going to be a healthcare thing that needs to be done. And so I wish someone would have told me, like, public health doesn't stop. Yes, you sleep, but I find myself now, like, eat, sleeping, and breathing public health. Even the books that I read, like someone put in the chat, thank you, the book that I was talking about by John Green. The books that I read too are like public health related or like healthcare related. So I think that's the only thing I wish someone would have told me. Like, the work just doesn't stop. You'll just keep talking about it over and over. Public health is very contagious and it's infectious, no pun intended. So once you get in it, you're literally like in it for life. There's always something to be interested in.
Yes, Ava, would you like to go?
Yeah. Hi, can you hear me?
Yeah.
Yes.
Yeah, okay, so I have a question. I'm a first year university student, but I'm also looking to work in healthcare. But healthcare is like a very big deal. So I'm not exactly sure like which type of major really. I'm just interested more about like healthcare is just very broad. So like how do you narrow down like exactly which part of healthcare you want to be in?
Yeah, I'm so happy you asked that question because let me tell y'all, I went through a whole journey in healthcare. So I started out in undergrad as a nursing student. And I realized that nursing wasn't for me. And so I transitioned over to the biomedical sciences realm. And I realized that I really enjoyed like just medicine in general and just the biomedical aspect of things. I loved seeing not only how diseases were spread, but how we can cure those. And then on the back end, how we can do things about them at the community level. And so the way that I narrowed it down was I knew that I wanted to do something in healthcare. So I found a big umbrella and I started doing my own little research. I was like, okay, these are the qualities that I have or I want to have in the future. So I want to be a public speaker. I want to advocate for others. I want to do presentations like this and do health education. I started looking at the things that I like and finding my niche, which I talked about in the presentation. I found my niche and I found what it is that I was passionate about. And I looked up fields that were related to that. And so, healthcare, like you said, is very big. You know, you don't just have to be a doctor or a nurse. You can definitely find what it is that you want to do. You just have to be very diligent in finding your niche and then finding what you feel as if would be great for you. So, I like to say if you feel like you're working at a job and you don't want to go every day and you just don't like it or enjoy it, that's probably not the job for you. I can truly say that every day I wake up and I'm excited to be a public health professional. I'm excited to work in the community, whether it's behind my desk or I'm actually in the community doing work. I love my job and I love what I do. And so, in order for you to find something like that, you have to know what it is that you want to know and know what it is, the niche that you want to do, and then know who you want to help. So those are the main three things: know yourself, and know your niche, and then know the group of people or the surrounding areas that you want to help. And that'll help you kind of lower it down because, again, healthcare is very broad. You can do anything, but narrowing that down will take some work, and it'll take you, doing the research and kind of knowing where you want to go with things, and then going from there. And feel free also to make mistakes because I made mistakes. Feel free to not have it all together right now, especially since you are in your first year. I think that's what you said. Feel free to not know what you want to do at all. Like I said, my first year I was a nursing student, and although I was good at it, I realized that wasn't my end goal. That wasn't what I wanted to do for the future. So you're gonna make some mistakes. You're gonna probably choose two, three different fields, but know that you're one step closer to choosing what it is that you want to do. In order to do that, you have to have that experience and to figure out what it is that you like and don't like, and then you can just go from there.
Thank you.
Yeah, that's so true, Dr. Britton. Sounds like you really thought deeply about the process. And
Yeah.
actually, that reminds me of something I've been wondering about. So, since you work so much in rural health, what do you think are the biggest misconceptions that people have about healthcare challenges in rural communities?
I think the biggest misconception that people have currently about rural communities is that they don't care about their health care. And it's not that they don't care, it's just that they don't have the resources that they need. And when they get the resources, it's usually presented to them in a way that they don't understand. So I think the biggest misconception is that, they don't care about their health. They don't want to work out and eat healthy and do all of these things to prevent chronic disease. That's not the case at all. We just need to be more diligent on presenting them with this information and giving them the resources that they need in a way that they will be more successful to it, and a way that they'll be more understanding and excited to talk about their health care.
Yeah, that's eye-opening. And so how do you exactly help urban-based like policymakers or colleagues kind of understand that these realities when they're making decisions?
Yeah, so I love doing presentations like this. I've keynoted several conferences surrounding rural health disparities, specifically in maternal and child health and community health and disease prevention. And so I'm very diligent in doing presentations like this and getting the word out there that yes, there is a public health concern in rural communities. Yes, there is a rural health disparity where rural communities have a higher disease incidence than urban and suburban areas. And there are issues with underrepresentation currently in medicine and the public health field. I say that. I make it known that this is something that I'm passionate about, that this is an issue, and that this is an issue that will continue if we're not diligent in making sure that we are giving the resources to these individuals and we are representing them in a way where they can understand it. Um, for me, I'm really big on going in the community as well. So I've never been afraid to actually go into the community and talk at churches and to go to community events, making sure that I'm in the community and that they know my face and that they're seeing a familiar face that they can trust and understand and get healthcare resources from. I'm there with them. I'm bringing them to the table. These are things that I do every day because it's not only important, but it's life saving. We are adding in these people because they need help and they know their healthcare better than anyone. And so, talking about the rural health disparities is a big one, and advocating for those individuals who may not know how to advocate for themselves, and just making sure that I'm in the community and that I'm giving them the resources, but I'm also presenting them with resources that could be helpful for them and utilizing those community voices.
That's really great. So you actually go within the community. Yeah, I actually really like that idea. So like making them familiar with you so they're not that hesitant.
Yes,
So
exactly. And
yeah.
that builds trust too. That builds trust within the community. Of course it helps if, we're there all the time, but just going to different church events or going to different community events, community outings, even if we're just going to help out at a food bank one day, anything that gets our voices out there in the community and gets the community familiar with us and to get them to trust us more is very helpful because usually when they see a healthcare professional, it's usually in a doctor's office, right? Or they're going to the emergency room. And so they kind of have a bad taste in their mouth with the healthcare field in general because they're only going to the doctor when something is wrong. So let's be diligent in going to the communities when something isn't wrong. Let's go to the park at a community event. Let's showcase what public health is and what the healthcare field is as a whole without there being a problem or something wrong. That's why I'm always diligent in going in the community. I'll tell anyone if nobody else wants to go, I'll do it myself. Um, I'll make sure that I'm the one there, not only having conversations with these people, but just showing them someone cares. And I think that goes a long way.
Yeah. Is there anything that ever surprised you when you started working in rural healthcare?
I think the statistics. So that actually surprised me. While I was doing my research for my doctorate degree, the statistics definitely surprised me because I went in wanting to do it on rural health and rural communities, and my hypothesis was correct. My hypothesis stated that rural communities have a higher susceptibility to diseases, specifically cardiovascular disease, heart disease, a lot of chronic disorders. I noticed that rural communities have higher rates in them. And I was saddened and I was disappointed in the fact that I was right because I so didn't want to be right with my hypothesis. And I think that was the most shocking and heartbreaking thing that I had ever seen because I was like, okay, I kind of knew that because I lived and I grew up in a rural area. So I knew that a lot of people had these disorders, but I didn't want to be right. I didn't want there to be an inequality in the type of care that people were receiving. I didn't want there to be someone receiving health care and someone not receiving health care based on insurance or income or socioeconomic status or even race and gender. Those were the things that shocked me the most when I got into the field.
Yes, thank you for that. I'm just so glad to know that there are people out there like you, just making a difference and making it a better community. I see another hand. Blue Aid Innovations again.
I'm sorry, I meant to say thank you earlier for your answer, but I didn't realize I muted myself. But
Of
how has,
course.
thank you. How has your faith played a role in your job?
Oh, this is a great question too. Ah, I love these questions. So my faith has played a major role in my job and then just who I am as a person. Um, I'm nothing without my faith, and I believe that my faith in God and my faith just in general has helped me love more and become the person that I am today. I've been able to show my faith by helping others and loving others and going out into the communities and just being around the people who need help. As a believer, I am charged with going out into the world and helping them and loving them and making sure that they're getting all the resources that they need. And so that's just one other thing that has been a driving force for me. I've been able to single handedly be in this field of public health and help other people because of my faith, because that has been my foundation. I'm able to get out there and love on other people and to give them the resources that they may not have had if they didn't experience me. So I believe that my faith has played a major role in being in this field and then just being who I am as a person too.
Amen, thank you.
Hmm.
I see another hand. Abisoy?
Obviously. Dr. Britton, can you hear me?
Yes.
Yeah.
Dr. Britton, what impact did the COVID pandemic have on you as a public health professional?
Yes, so thank you for your question. The COVID pandemic, I was actually wrapping up my bachelor's degree during COVID. So I lost a year of my bachelor's degree. So my final fourth year, I was supposed to be interning at a location, and that got cut short because of COVID. But I actually was on the front lines working. So I was finishing my degree, and I actually had to graduate virtually, like a lot of us did. So that was impacted. But COVID actually made my interest in the public health field grow. Because I saw how the public health professionals were targeting and tackling this, specifically those who were at the CDC and even those that were just at the local level doing some COVID testings and COVID shots and all of that. I saw a need for a public health professional and I went for it. I worked in a lab for about 2, 3 years after COVID and then during COVID. So I was
Mhm.
on the front lines every day doing the COVID test and then going back to the lab to test them. So it impacted me greatly because it made me want to be in the public health field more. So it was tiring, and then it was scary at times because I'm a caregiver again for my mom, and I didn't want to bring any COVID or any illnesses to her because she is immunocompromised. But
Mhm.
on the other end of the spectrum, I was able to find out that I really enjoyed public health and I enjoyed talking to people and making sure that they were helped in any way that they could be helped. So being on the front lines helped me gain more insight into the public health field. And then on the other side, again, it was a very sad time for a lot of us because we were in isolation. When I wasn't working, I was in isolation as well. So your public health and doctors and nurses and all of the providers, you guys, you weren't just in isolation by yourself. We were also in isolation too. But being able to just connect with more people and just provide care for them, I think that was my breakthrough in public health for sure.
Thank you.
Hmm.
Yeah, that was a great insight. So, is there anything specific you learned from the CDC and local public health response that you still use today?
Yes, so I learned not, the first thing I learned was not to panic. I learned not to panic when there is a problem. I learned how to address certain concerns and to speak to a wide range of people because we were seeing so many people every day. And I also learned how to become educated and then give out that health information that I received in a way that the community would understand. I noticed organizations like the CDC, and then the local health departments, they were very diligent on making the information accessible to all. And so they would put information in their flyers and online and, on the internet where people could understand them better. And so that's kind of what I learned how to do as well. I learned to pivot and make sure that I was able to speak in a way where everyone would understand me. And I was able to learn how to connect with other people where they were, and just to spread information in the best way possible. I think those are the things that I took from those organizations during that time.
Yes, thank you for that insight. Oh my God, lots of questions here. Abisoy, would you like to go again?
Dr. Britton,
Yes.
did your PhD involve any laboratory work? And if so, what techniques did you utilize in the lab, if you did any at all during your PhD?
Yeah, so I can talk a little bit about that. My doctorate degree was on cardiovascular disease in rural communities, specifically in communities that were in Virginia. And so I did a qualitative study where I interviewed individuals who either had cardiovascular disease, or had disorders relating to it. So hypertension, coronary artery disease, diabetes, obesity, all of that. And so I ended up interviewing individuals based off of the current healthcare that they receive, and if they knew anything about cardiovascular disease or if they knew all of the statistics. And I didn't do any lab work for my doctorate degree, but I did do a qualitative study, and I did, again, interview individuals to add in their real voices on top of the statistics that I found. But for my master's degree, I actually did do some lab work. Again, that was right when COVID was in the thick of things. And so I was able to do some lab work there as well, and do my capstone on sickle cell anemia and how COVID attacks your red blood cells. So that was pretty cool.
What techniques did you utilize in the lab?
I think what did I do in the lab? I think I just utilized, so what we did was we took blood from individuals who had sickle cell, and we were able to look at their cells, and then we were able to take some from someone who had COVID, and I just looked underneath the microscope to see what the difference was. So it wasn't a real big, like laboratory thing, but it was added into my capstone at the end.
So you were looking into the effects of the pandemic on sickle cell
Yes.
patients.
Yep. And that
And
was what my master's capstone was.
was there any association between the pandemic and sickle cell?
So unfortunately there wasn't a big like there wasn't a big like correlation between one another. It didn't look any different. The only difference was that the person obviously who had sickle cell and had developed COVID, they had worse symptoms than someone who didn't have an autoimmune disease. And so we didn't see that internally, but we did see that externally, where if you were immunocompromised, you did have worsening COVID symptoms than someone who wasn't.
Thank you. Thank you.
You're welcome.
Dr. Britton, we have a question in the chat. Someone is
Yes.
asking, what does your typical day look like?
Ooh, fun. So it depends on what day of the week it is, honestly. So I'll give you three different types of days. So first day, because I am in the community health work, I'm in the community. I do a lot of blood pressure checks, health education, presentations. I do a lot of those. And then I do a lot of tabling. And so I go to different events and I have resources on my table, and I develop relationships with the community based off of what they need. I know in my rural community, we have a lot of cardiovascular disease and maternal and child health issues, mortality and morbidity. And so you'll see my table having some free resources like COVID test kits or STI test kits, blood pressure monitors, all of that. So I'll have all of that on my table, and then some resources from our local food distribution centers, our local health departments. All of those will be on my table. at community events. So you'll either see me in the community doing a presentation or doing some tabling where I'm out there still at the table, but still educating the community and talking to the community and getting out there at these community spaces. Second thing would be behind the desk. So I do a lot of project management. My team is very gracious in allowing me to help with a lot of different projects that we currently have going on. So I create a lot of different ideas and help with a lot of different ideas that turn into bigger initiatives. So those are kind of the cool things that we do in office. We create projects for our communities, and we create events and all of those things to where we're able to branch out and show public health for what it is. And then also behind the desk, I'm talking to clients. So if I do develop a relationship with clients, I do reach out to them. I don't just talk to people one time and that's it. I reach out to them every so often and I see what type of resources that they need and I keep those relationships up. So that's what I do in the office. And then outside of both of those, again, I love advocating. I've been on the Hill and advocated for a lot of different research groups and a lot of different healthcare initiatives. I've done that so many times. So I've actually gone to the Senate and talked to a lot of representatives from the state of Virginia, just advocating for better healthcare needs overall, specifically for rural communities. Obviously, again, that's my niche. So you can either find me behind the desk, talking to clients, making some initiatives that I have in my head come to life, or you can see me out in the community doing some health education, or you can see me advocating in DC. Either way, it depends on the day.
Yes, that's great to hear. For the next one, we have Ronan.
Yeah, it's Ronan. Hi. I remember hearing you say how you take information and make it more accessible or way for other people to understand. I was wondering if you could elaborate on ways you make certain information more accessible or understandable, I guess, for the wider audience.
Yeah, so I'm a firm believer in not using medical jargon. A lot of the times, public health professionals and doctors, we tend to use a lot of medical terminology that not many people understand. So I make sure I'm diligent in using words that everyone would understand. So instead of saying cardiovascular disease, for example, I would say heart disease. Um, instead of saying just heart attack, I would say a heart attack, but instead of saying a cardiovascular event or myocardial infarction, I would say a heart attack. So making sure that I'm diligent in adding words in that people will understand, and then translating. So we utilize a lot of translation services to translate into Spanish in my area because we do have a large Hispanic population. And so when I say making them accessible, I mean actually going in and making sure that every individual can understand what's on this resource list or what we're talking about when we're talking about a heart attack or a stroke or diabetes. So I'm using words that everyone would understand and I'm speaking to them in a way where they would also understand because I noticed that when we use medical jargon and when we use words and phrases that the community doesn't understand, it just goes right over their head. So I'm very diligent in doing that and making it accessible to them in that way. And then if we want to talk about accessibility as far as making sure that they're actually getting the resources, I'm going where they are. So if the community hangs out at the library, I'm going to the library. If they hang out at a certain community center, I'm going to the community center. I'm going to those churches. I'm going to talk to everybody. So those are just some of the ways that I make the information that I'm sharing more accepted and more accessible to those in my area.
Awesome. Thank you.
hmm
After that, I see Blue Aid Innovations again.
What do you think has been the s- single greatest highlight of your career or the thing that you're most proud of?
Yeah, I think for me, the most thing that I'm proud of is, hmm, that's a hard question. Everything makes me proud because public health is just such a great field. But I think the single most thing that I'm like most proud of is just being able to help the community that I grew up in. I still live in that rural town. I'm still able to see the people that I've always loved and cherished my entire life. But I think for me, going to school and being able to come back and actually help my community is something that I'm very proud of. Because a lot of the times we'll see people in rural communities, they'll get an education or they'll get a better job and they'll just leave the community, and that doesn't help anyone. So I think me coming back to my community and actually helping the rural area, and giving them the resources that I needed as a kid, and then the resources that I know that they still need, I think that's powerful. I said this in another interview and in another meeting that me coming back home to work in my community was like a love letter to my community, you know, because I love it. And I definitely want to see it grow and continue to grow. And so I'm most proud of just staying in my community and just going to school and bringing that information back to them.
That is so great. Awesome.
Thank you, Dr. Britton. It's so nice to see how passionate about you are about this field and all your contributions. Um, Jennifer, are you here with us? Or I can ask your question too.
Sorry, I'm here. Uh, Hi. My question was to you. What are the what do you do when there's a roadblock? For example, you said that there's problems with certain people getting insurance for healthcare. What do you do when there's a roadblock that doesn't allow them to get healthcare?
Mm. That's a good one. So I've actually had a client before. They didn't have health care, and specifically, they didn't have insurance to receive health care. And so what I did was me and her sat down together and we literally went through all of her options. And so if she didn't have health care, if she didn't have insurance, we found her some free health clinics that were able to find what she needed and was able to get her the care that she needed. We were also able to utilize local health departments where there is a sliding fee. So you pay what you can. You pay based off of what your income is. And so she was able to utilize those resources as well. And so I find myself a lot of the times in my job being creative and going in and making sure that I'm looking at all the ends. No stone is left unturned with me. If you don't have insurance or if you don't have health care, I'm going to find you some way to get healthcare. I'm going to find you some way to get the resources that you need. And we were able to do that with her. Where there's a will, there's a way. So whether it's getting you the insurance or getting you different healthcare measures or types, even if it's just going to a community health fair and getting what you need from there, we can do that. There is a way for you to receive health care. You know, it's not always easily accessible to people, but it is accessible if we do the work.
Thank you.
Mm-hmm.
All right. Does anyone have any final questions before we start wrapping up? Okay, cool. I'm gonna start wrapping up and here's my presentation. Okay, once again, thank you so much, Dr. Britton, and all of you for attending today's session. And three questions I have for you today are, what was your favorite moment or example from today's session? What's your idea from today that you're more excited to explore next? And what's one key takeaway or idea that stood out to you the most? Feel free to raise your hand and answer the question or drop them in the chat. And we would love to hear your insights. So please feel free to share your insights on LinkedIn, or you could also tag us on Instagram or just fill out the survey in the PHS website. Once again, if you're interested in being part of the pre-health shadowing team, feel free to go through our website and sign up for any role you'd like. You can be part of our leadership team or also be a volunteer. Is there a question here? No. Okay. And thank you so much for all those who have already donated. And this organization runs mostly on donations and volunteers. So if you donate when you can, and we appreciate any donations, even if it's $1. Um, don't forget to take the shadowing assessment after the session if you want to gain volunteer hours and a certificate. And if you had to leave early or joined late or just missed a part of today's session, no need to worry about it because we post sessions on our YouTube channel. So just feel free to watch any of the previous sessions for free. And thank you so much. Are there any questions? Let me see. No?
I have a question for Dr. Britton. Dr. Britton, do you think we're prepared for the next pandemic? Do you think as the Earth is prepared for the next pandemic, given our
Ooh.
experience of the last one?
Ooh, I've been asked this question recently, actually, very recently, like yesterday. Um, in some aspects, yes, I do think we're prepared for another pandemic. Specifically because we dealt with COVID, and that was our first pandemic in a long time, and we had to learn how to deal with that. A lot of people don't show enough grace to those who did have to deal with COVID, specifically the public health professionals. But realistically, none of us was alive during the last pandemic. And so we had to learn how to maneuver through this pandemic, like actually go forth and do the education and be on the front lines. So I think we did, as a field, we did learn a lot from that pandemic, specifically how to care for patients and how to have patient centered care. So I do think we will have a better outcome overall. I think we may struggle still with mass production. So if we do have to have more vaccines, if we do have to have more medicines being produced at a higher rate, I think we may struggle a little bit with that and the manpower. But that's just because there is a shortage of healthcare workers and healthcare professionals. But outside of that, I do see us tackling another pandemic mostly better than how we handled the first pandemic, just because we recently went through it and we learned a lot from that, and we're able to move forward from that because we did have those experiences. Experiences in life, to me personally, only make us better and only help us grow. And so, because we had that experience, I do think we'll do a little bit better this time around. Hopefully, we don't have another pandemic, but if we do have another pandemic, I have full faith in the public health field and the medical field to react accordingly.
Thank you.
Mm-hmm.
Okay, once again, thank you so much, Dr. Britton. We
Yes,
truly appreciate you sharing about your experiences and expertise with the pre-health students. And your story definitely inspired me and all of us
thank you.
today and helped
Thank
us
you.
consider our own paths. Thank you so much.
Thank you. Thank you. And I really appreciate just being able to come back again to pre-health shadowing because you all were the catalyst